thank you for having me today. I really appreciate it. I know you all were expecting Heather Romero, who is our financial aid director. However, she could not make it today. So you get me presenting the New Mexico State Loan for Service programs and also our health loan repayment program. I do have a presentation created to go over today. While I'm going through the presentation, feel free to ask any questions while I'm on a particular slide, or at the very end, there also will be a Q&A slide that you can answer. You can ask your questions at the end if that's what you would prefer. So the New Mexico Higher Education Department Financial Aid Division is dedicated to helping students pursuing their educational goals by educating students, parents, and the community about state aid opportunities. The Financial Aid Division provides over, I think this is $300 million at this point in financial aid to students in New Mexico. A variety of programs are offered to meet the needs of our state's diverse population. First, we have our health loan for service programs, and these programs are medical, allied, and nursing. And these programs are for students. So the loan for service programs are for students. We give funding to the students in these health fields. We send that directly to the institutions. And then upon a grace period upon graduation, then that student goes ahead and starts their service obligation. So the loan for service programs never have to be paid back by the student if the student intends in providing service within the state of New Mexico. All right, and this is for students seeking certification, licensure in any eligible health profession. And then as a condition of the loan, the student must declare their intent to practice as a health professional in the state. Let's say we give 1 year of funding for their schooling, they in turn will do 1 year of service within the state, and that can go up to 4 different years. This is the health loan for service programs. This is the eligibility for those loan for service. You have to be a New Mexico resident, which is 12 consecutive months living within the state of New Mexico. You have to attend a public post-secondary institution in New Mexico. I think this is blocking it too. Undergraduate or graduate student enrolled at least half-time, and you must demonstrate financial needs. So that does include the FAFSA. So for the loan for service programs, you must complete a FAFSA so you can demonstrate that financial need. And then again, declare your intent to practice as a health professional within the state. All right, we're going to go into the programs now, and they are pretty much the same. This is the Allied Loan for Service. This is anybody going into, you see some of the eligible health fields for the Allied field. And this is much more lengthy than you see here. This is just an example. And the award amount for the Allied Loan for Service is $8,000 per semester, $16,000 per year. So if you are awarded this, we will send that $8,000 per semester to your institution, and they will apply it to your student account. The award is for 1 year, but again, can be renewed up to 4 years. And this application for the Loan for Service program, the applications for this are on our website. The application opens May 15th and it closes on July 1st. Medical, kind of same enrollment requirements, at least half-time. Medical pays $25,000 per year, which is $12,500 per semester. Again, that gets sent to the institution. Same application dates on this program. And then the nursing is very similar to the Allied as far as the amount awarded, $8,000 per semester, $16,000 per year. Now, we do have a program called the Nurse Educator Health Loan for Service, and these amounts are based on enrollment. So depending on the number of credit hours that these nurse educators are taking, you can see the award amount awarded for this particular program. Again, this program can be renewed up to 4 years. And the application is on our website as well. And this is for nurse educators, employed nurse educators teaching within our institutions, and then also attending an institution. We also have what's called our WICHE program. This is the Western Interstate Commission on Higher Education Loan for Service program. New Mexico does not have a dentistry school, vet med school, or optometry school right now. So what we do is we allow New Mexico students to enroll in out-of-state programs that are not offered within our state. The student declares their intent to return to New Mexico. So what we do is we send those funds to these out-of-state WICHE schools. And 6 months upon graduation, that student, once they return to New Mexico, they start fulfilling their service obligation. Again, you shouldn't have to pay anything back on this loan if you are intending on providing your year-to-year service within the state. Again, the field supported are dentistry, vet med, optometry. The requirements are U.S. citizen, graduated from a New Mexico public accredited high school, or resided in New Mexico for 3 consecutive years. We do ask for a high school diploma in that application. If you don't have that, then we would require 3 years of tax forms to prove residency. This slide kind of gives you an idea of what those support fees are that we send out to those out-of-state institutions for the WICHE program. So as you can see, for vet med, for academic year 23-24, it's $34,650 that gets sent directly to the school to offset that tuition rate. And then the support fees slightly increase each year. About $1,000 each year is the approximate increase on these programs, and this is renewable up to 4 years. This particular application is on the New Mexico Higher Education Department website, and this one opens on August 1st of every year. This is a listing of kind of an idea of the schools that we do support under the WICHE program, the different institutions for dentistry, vet med, and optometry. And now we're going to go into the New Mexico Health Professional Loan Repayment Program. I'm sure many of you have heard of this program and may have plenty of questions regarding this program. So we call this the HEPLR program. It provides repayment for outstanding student loans for practicing health professionals in New Mexico. As a condition of the program, a health professional must make a 3-year service commitment. I know in the past you heard that used to be 2 years. There was some legislative changes that now that is a 3-year service commitment to practice full-time in a designated medical shortage area within the state. Eligibility requirements: U.S. citizen or permanent resident alien, New Mexico resident, which is that 12 consecutive months. Licensed or certified in the state of New Mexico by the date of the service agreement, which our agreements for the HEPLR program begin every October 1st. You must be employed full-time. Full-time for this program is at least 36 hours a week, and preference is given to graduates of New Mexico public post-secondary institutions for this program. So what would happen is, again, that agreement starts October 1st. You would work October, November, December. Come in January, you're gonna, what participants will do is send in an employment verification form. So the payments are sent out quarterly for this program. Come January, you and your employer are going to fill out a form, send it back to us. At that point, we're going to send payment out to your loan provider. So what's great about this program is you've already provided the service. So there's no, you've provided October, November, December service. We're just verifying that you did that, and then the payment is getting sent out. So that's nice, as this program then really doesn't have any repayment options. Somebody that maybe didn't provide service and isn't eligible for that payment. So, you know, making the payments that way has really helped out with this program. Now, these are just a few of the program occupations. There are a lot more on our website. So you can see the allied fields that are supported: dental fields, medical nursing, and mental health fields. We just added registered nurses last year, And so we've seen that grow greatly with this program, and I'll show you some of the numbers in these upcoming slides. So the maximum allowable award is $25,000 per year. Other factors may affect the award, such as student loan debt. So, you're locked in for 3 years. So that's a total of $75,000 being paid to your student loan provider. If your student loan debt is under $75,000, then that amount quarterly, annually and quarterly, of course, is going to be reduced slightly. And this particular application opens on March 15th and closes May 1st. Participants of HEPLRB are awarded based on the applicant's current position, county, facility, and the time of application. This was a big question this year with the participants that were awarded for FY24. Upon a full year of service at your current position, county, and facility, a change in employment may be considered by the New Mexico Health Advisory Committee. Also, if that year isn't complete yet and there are mitigating circumstances, we will take those into consideration, send them to committee, have a conversation about maybe a move to a different facility. And it's kind of a case-by-case basis. So we do like to see that one full year served at your current employer in your current role, but that's always an option. So this is the program data. So as you can see, we got a great deal of funding in FY24. We received actually $14 million for this program. In the past, the funding wasn't that great, as you can see. Awardees in FY21, we awarded 22 people, 21 people, 44. This year, we awarded 702 awards to New Mexico health professionals working in the state. So we hope to have that funding again for this upcoming year. We hope to receive that from the legislature and have that funding roll in so that we are able in FY25 to award maybe even a higher number of participants. So I thought this was interesting. Again, the average amount for the first year of new awards is $25,000. That's the average award that we get per awardee. This is a map of the practice locations. You can see that we have awarded health professionals practicing in pretty much all over the state. It's really exciting. Okay, so with that, I'm going to stand for any questions.
Hi, this is Dr. Julie Martinez. I'm a family practice primary care physician, private practice in Santa Fe. And I just jumped on because I saw the invitation through the New Mexico Medical Society. And I was just kind of interested to see, yes, how this program had evolved and changed recently. And I'm definitely surprised by the numbers of the accepted applicants. And while it's super exciting and really interesting to see how that all pans out, I think it's interesting timing because, there was a recent article regarding the National Health Service Corps and how maybe that program didn't really work to solve, sort of the underserved problem. And I was actually a National Health Service Corps recipient for 2 years of service, and that was probably like 15 years ago. And I have to say that the issue with there were issues that came up, especially when an employer is aware that you're a recipient of an award like this. Sometimes that leaves room for underpayment of the professional. And I think, I'm just really curious because the numbers weren't very large before, and now they're quite large. I'm just really curious to see how this all works out. It's tricky. I think incentivizing healthcare in underserved areas. And, my personal feeling is, really as culturally, we just need to treat our healthcare professionals, well, compensate fairly. But a lot of times that's not always happening. So I just thought I'd just throw that in for your just information.
Thank you. I appreciate that. And I will share that with our financial aid director. We haven't had any hiccups that we've seen. It was a huge program to roll out this year as far as sending agreements and getting them back in time. And so more of an administrative strain. But other than that, it seems that people are really happy and surprised, being that, because of the extra funding, we were able to award health providers in Albuquerque, at UNMH, in Bernalillo, in Las Cruces. And so in the past, what happened, because you saw, we awarded 22 people, I think, one year. What the committee was really looking at is those really in-depth need in the rural areas. And what happened was, with this increased funding, we were able to really broaden the areas, and the health providers in New Mexico that are working, in an ER capacity, or helping substance abuse, things like that. So the committee had a really long meeting, I'll tell you that, reviewing these applications. And it was just a really great thing. The people that you saw that were not awarded really weren't awarded because they didn't meet the eligibility requirements in the beginning. It wasn't really anybody cut out for positions or counties or things like that, which was a big change, as I think Julie, that you were really familiar with this program. And so that was great to see this year, and we hope that continues in the future.
Yeah, no, thank you for that. Yeah, it'll be really interesting to see, because that's a lot of investment. I think that the numbers are a little low, like for the awards, because again, when I was working with the National Health Service Corps, I think the loan repayment was $20,000 per year. And that was in, gosh, that would have been in like 2005, 2006, 2007, probably. So I do think that the numbers for a physician, and then of course, you might change the spread. I think the numbers are kind of low. It might be interesting to see what other states are offering for their loan repayment. And I see that, you did mention that you're prioritizing graduates of New Mexico institutions. From my opinion, I don't think that matters at all. I think that there should be no I wouldn't prioritize that. I would just, anybody who's interested and motivated and qualifies, I think should be given the opportunity. And, I'm a native New Mexican, and I did all of my education elsewhere. I would not have been, prioritized for this type of an award. Mm-hmm. But, I moved back to New Mexico in 2008 after I did my National Health Service Corps obligation in Southern Colorado. So, I don't know. Look at what the playing field looks like out there, because really we just need healthcare professionals. This program could definitely, if it was really nuanced and supported, it could be successful. Again, I would look at that article about that recently came out about the National Health Service Corps and see why they were saying that it didn't, why looking back it didn't work. That way, maybe we can make this program more successful.
Absolutely. And I have written all of that down, and I will take that to the director, and we hope to follow up with you all. After this legislative session, maybe come back and give an update.
Great.
Thank you. Any other questions? I will put up this slide. I think I'm still sharing my screen. This is the 1-800 line. I'm Mia Candelaria. You can always call that number, just ask for me and we can discuss this program in length. Like I said, there's a lot of case by case basis. So feel free to call me and we can discuss kind of your questions or what you're thinking. I would be happy to talk with you all.
All right. Are there any other questions?
I just had a comment, or I guess a question. Do you mind sending out the slides from this presentation? It was really helpful.
Sure. I will send this over to you, Mario. Should I go ahead and just send that to you? Okay. Yes, I will send that over as soon as we are done here. Absolutely.
Thank you so much.
And I guess I do have a question. In terms of, you talked about the financial need and, them filling out FAFSA. In terms of that financial need, do you take into account whether they're already receiving maybe some funding from another source or like another loan repayment program like HRSA?
So yes, so that goes through the financial aid office at their institution. So when the student is filling out the FAFSA, any grants, any other scholarships, things like that are always taken into consideration. My advice for anybody in school going down that healthcare path is talk to us, call our office before you take out any type of loan. Scholarships, grants, those are different, right? I mean, that really benefits the student, but any type of loan, let's see what we can do for you first. Let's see if you can meet the qualifications and get awarded for these loan for service programs instead of taking out that loan. Because if you do that first, what's going to happen is when I review your application for these students and I see that need is really low, more than likely you're not going to get awarded. But if that need is low, I'm looking at maybe a couple of loans that you've taken out there that you signed up for. So I always give that advice. Call our office, email me, call me directly, and I'll walk you through that before any type of loan is taken out.
And also in terms of residencies, we know that, like a family medicine residency is a 3-year commitment. Does that factor in to that kind of 3 years of service if they do it somewhere like, Española or Shiprock?
So right now, and this is something that we're working on right now, if anybody does their residency at UNMH, it counts towards service. Anywhere else, what we do is we would put your account on a deferment or postponement. And then once you've completed that residency, then we would start seeing, have you secured employment? Then we'll start counting service. So right now, again, it's only UNMH that counts for residency for service. We are looking at other facilities within the state that we can offer that same option to. Heather Romero is actually our new financial aid director as of November 11th, so a couple of days. And so we're really looking at all these programs to see how we can improve them and what we can do for students. And so that's something that's come up in the past.
And kind of related to that, could there be different numbers involved when it comes to primary care? Because, if you're doing that for all the residencies at UNMH, you're not necessarily giving primary care or a leg up there.
Okay. Yes, I will. I've written that down and I will take that to our director as well. Thank you for all of these comments. I really appreciate it. And that's what we need is, speaking with you all and finding out what the need is, how these programs can help students better. And that primary care, yes, that's an absolute great example. Thank you.
Mia, I want to say thank you very much for joining us today. And if there are no other comments or questions, we'll go ahead and close it out.
Thank you for having me. I appreciate it.